Well, welcome. I'm Dr. Jeffrey Bland, and I'm your host for this Personalized Lifestyle Medicine Institute education program, one that is our 2024 series that I believe is going to expand the clinical horizon for the value and clinical effectiveness of personalized lifestyle medicine intervention. So this particular program is one that we have not had the opportunity to talk about in previous discussions, and I think it's going to be very, very valuable as another part of the armamentarium of clinical tools available to the practitioner in the personalized lifestyle medicine environment. And it has to do with the modulation of the parasympathetic and sympathetic nervous system function. It has to do with tone of the vagal nervous system, one of the important, as you know, cranial nerves, and how that innervates and participates in function across a wide range of clinical conditions. We'll be talking about those over the course of the next couple of hours. And I think I'm going to really say that our experts, I have the privilege of being kind of the introducer of the topic, but our experts that we have assembled for this program will really bring news to use, information that can be delivered and valuable in the clinical management of patients who may be disturbed or have imbalanced integrity between the parasympathetic and sympathetic nervous systems. So with that as kind of a broad brush introduction, let me move to share my screen with you here, and we'll get into the information of the hour and talk specifically about the improvement of vagus nerve system tone, and it being the therapeutic gateway to the immune nervous system as a supersystem, this interconnection between the nervous and immune systems. And as I mentioned, we have two extraordinary expert clinicians to help guide us through the news to use of this topic. Dr. Nawaz Habib, Dr. Peter Statz, both very skilled in the art as it relates to vagal nerve function and therapeutic modulation of its function. I also want to thank electroCore for being a co-sponsor of this educational program. They bring extraordinary expertise and technology to the assessment and intervention of vagal nerve function. So I think we have rounded out a really resource-rich experience here over the next 2.5 hours that we're going to share together. So with that in mind, let's move to the program. I'm going to be doing the introduction between the connection of vagus nerve function and the immune system and how that interconnects neuroimmunity to pain, inflammation in the vagus nerve. Dr. Statz will take that topic up. And then from that to Dr. Habib, who will be speaking about clinical approaches to improving vagal tone. And then, of course, the part of the program I always so enjoy, the end of our program, where we get together in a panel discussion, a free-flowing discussion among the three of us to really talk about some of the things that we jointly learned or value that have come out of the program. So with that in mind, let me jump in here to do the introduction. So stress and distress, and how do they interrelate between parasympathetic and sympathetic tone? I think this is a broad review for all of you, so I apologize if I'm treading on old information, but it just, I think, is important to set the context of the discussion that we're going to be having. So sympathetic tone has been associated with things like excessive tachycardia, stimulation of heart rhythm, increased respiratory rate, hypertension, pupillary dilation, dry mouth, constipation, urinary retention, increased sweating, and pro-inflammatory immune status. And that's why I've kind of highlighted that. In the parasympathetic area, the activities of its action include slowing of the heart rhythm, bradycardia, decreased respiratory rate. You notice these are counterpoints to the sympathetic tone, lower blood pressure by vasorelaxation, pupillary constriction, normal salivation, normal bowel peristalsis, normal urinary control, normal perspiration, and more of an anti-inflammatory immunological status. So a Th2 versus Th1, or an M2 versus an M1 type of immune system personality. So these are the general rules about the two components of the nervous system modulation of the neuroimmune system, and how that interrelates to clinical symptomatologies. And so the optimal is to find balance points between the two, not being overly sympathetically driven or over parasympathetically driven, but rather to be in balance one with the other. Unfortunately, however, as we recognize the world in which we're living today, often we are in a state of sympathetic drive, sympathetic hyperarousal. So the sensory stimuli that we're taking in all the time, coupled with our immune stimuli, interact with both the parasympathetic and sympathetic systems, but mostly with the arousal system being activated, the HPA-T system, the hypothalamus, pituitary, adrenal, cortical, thyroid connection. Now we get sympathetic drive, and we start to see alterations in downstream influences on receptor sites of these catecholamines that influence in our immune system and cause immune activation related to then things like the release of immune active inflammatory molecules, the cytokines. So there is a connection, obviously, then between parasympathetic and sympathetic tone, immunological function, inflammation, and anti-inflammation. The vagus nerve is the conduit. It's a central player in this regulation process. It is this long cranial nerve that travels across many distances in our body to regulate the function and to take information back to the brain. So it's a bidirectional information system, the vagus nerve, that has so many different impacts upon respiratory function, digestive function, hepatobiliary function, renal function. So it is a really important regulator, shop boss, executive center for interfacing the nervous system with multiple organs and ultimately the immune system. Now, it turns out that the measurement of the balance between parasympathetic and sympathetic nervous system function can be done by looking at a number of proxy assessment tools, or might be called surrogate markers. One of those is a technology that most of us are familiar with, heart rate variability, or HRV. HRV is a translational dynamic biomarker that really is reflective of altered autonomic function in both healthy and in psychiatric disease or disturbed emotional states. This has been very well understood. This review paper that recently was published talked about the autonomic nervous system responsible for the precise regulation of tissue functions and organs, and is crucial, therefore, for optimal stress reactivity, adaptive responses, and particularly managing challenge states where the body is under stress. The fine-tuning of the autonomic nervous system relies on the internal central control, and it then is interfaced and communicates through the vagal nerve network that we described earlier that are interconnected then to our immunological functions. So it's a network biology phenomenon. So what is heart rate variability? Well, as you know, we all recognize a healthy heart produces a rhythmic pattern of contractions, and those are generated through electrophysiological functions that tie to the heartbeat and the heart rhythms. So generally would say that there are the regular heartbeats somewhere about a heartbeat a second, 60 beats a minute. But if we really look at this much more closely with a very, very fine inspection or technology that allows us to analyze the pulse frequency time in between heartbeats in healthy and well-trained individuals, what we find is that they don't actually fall exactly on 1.0 seconds between heartbeats or whatever that rhythm is, that there is variability among the different beats, slight variability. That's the heart rate variability. And it turns out that individuals that have a lot of plasticity in their heart rhythm have metabolic plasticity, have high resilience. This is or associated with a parasympathetic balance, and that means HRV increases. Individuals that have a much more distressed physiology, one that's under challenge, that is in an alarm state, that is trying to accommodate threatening insults, be it chemical, biological, or psychological. In that case, the heart maintains a much closer rhythm, and it loses its heart rate variability, this plasticity, dynamic range, metabolic degrees of freedom, whatever you want to call that. So low HRV, parasympathetic; high HRV, more sympathetic driven, based on this as a surrogate marker for a functional status. So if you start using HRV as a surrogate marker, as a proxy for the balance between parasympathetic and sympathetic nervous system, you find that you can start using it in a whole variety of different conditions that are associated with inflammation to see what state of dysfunction or inflammatory state the individual is in. Here's one such paper discussing non-inflammatory pain in arthritis, showing again its interrelationship between clinical symptoms like disturbed sleep, low mood, anxiety, chronic pain, but also the alteration in inflammatory biomarkers like IL-6 and the changes that is associated with as it relates to HRV. So HRV is connected into this network biology I talked about that integrates the vagal nerve tone and vagal nerve action. And so we know that non-invasive vagal nerve stimulation has been used for the management of rheumatoid arthritis. This is a recent paper looking at, this is in the Lancet Rheumatology Journal, looking at prospective open-label single-arm trial in rheumatoid arthritis patients that had vagus nerve stimulation up to 30 minutes per day, and showed that there was a very significant reduction in pain and inflammatory markers after the intervention with vagal nerve stimulation. So this again ties together a biomarker, HRV, with intervention, in this case a vagal nerve stimulation, with outcome phenotypic markers associated with rheumatoid arthritis pain and disability. So vagal nerve stimulation reduces then these inflammatory cytokines like IL-6 and IL-1 beta in patients with epilepsy. This is a paper published in the Proceedings of the National Academy of Sciences recently, again showing IL-6 reductions and IL-1 beta reductions, the pro-inflammatory mediators associated with vagal nerve stimulation intervention. So the vagus nerve, which mediates then of the immunoinflammatory responses, can be a very important tool in supporting, as this paper says, homeostasis of optimizing the health function, and that it can be modulated and improved through stimulation of the vagal nerve. And stimulation means finding ways to actually create a signal back to the brain that signals through this network of biological interacting functions to restore proper immunological balance, lower inflammatory signaling, and produce the requisite balance between parasympathetic and sympathetic tone. Now, one of the reasons that is being explored as to how and why this works is through an epigenetic modulated pathway. As you know, epigenetics encompasses the changes in gene expression triggered by environmental cues that occur without altering the underlying DNA sequences. And so you start using various ways to look at the epigenetic marks before and after intervention. These would be things like DNA methylation is a common laboratory technology used to look at epigenetic modulation of the genome. And so they've been looking at the importance of what happens to the epigenome after intervention with vagal nerve stimulation, and finding that, lo and behold, that not only are clinical outcomes improved in patients with psychological disturbances, depression, anxiety, mood swings associated with inflammatory disorders, but also their HRV improves, and their vagal nerve function improves through the vagus nerve stimulation. So again, showing the interwoven components of all these what might be considered contrasting physiological processes that then all bear their function and signaling determination through the vagal nerve process and its interconnection to the immune and nervous systems. So non-invasive vagus nerve stimulation obviously has the potential to have a beneficial effect on cognitive function through autonomic and parasympathetic regulation, helping to preserve cognition in a state where cognition can be deteriorated as a consequence of brain pro-inflammatory states. So in this particular paper published in Psychophysiology this last year, preservative cognitions provoked by psychological and physiological stress in the absence of acute stressor are considered important diagnostic vulnerability factors. So in this case, looking at HRV as a surrogate marker for autonomic inflexibility, and then vagal nerve stimulation and vagal nerve function, it was found that one could rebalance HRV while rebalancing parasympathetic and sympathetic tone, and in so doing, in this study, compared to a sham, improve cognition, sensory perception, reduce distress and anxiety. So, gee whiz, that's a pretty powerful list of clinical outcomes that one gets from the remediation of vagal nerve dysfunction. So evidence of transcutaneous vagal nerve stimulation and effects on sleep. This is a study done in veterans who are suffering from post-traumatic stress syndrome. These are individuals that had sleep problems and a lot of bad dreams. They're common among veterans with post-traumatic stress disorder and closely associated with this hyperarousal collection of syndromes associated with sympathetic overdrive. So in this case, they used transcutaneous vagal nerve stimulation to evaluate whether it had a positive impact upon sleep quality in veterans who had PTSD. And the study examined the effects of 1 hour of stimulation at lights out on sleep architecture and autonomic activity, the balance between sympathetic and parasympathetic function in 13 veterans with fairly serious PTSD and very, I would call it, malignant sleep disturbances. They did this against a sham treatment, so it had its own internal placebo. The pilot study provided evidence that transcutaneous vagus nerve stimulation improves sleep depth and stability in veterans with PTSD, as well as increased parasympathetic function and lower than those effects that are associated with sympathetic overdrive. So I think there's a lot of encouraging work going on. Still early on, this is new explorations, new therapeutic tools, new frontiers, but it's certainly opening up a really interesting body of literature as to how to modulate things that we've maybe in the past thought were only modifiable by some kind of a material intervention with a molecular intervention. Now we're talking about energetic intervention, transcutaneous vagus nerve stimulation that can then affect then the downstream signaling, maybe through epigenetic mechanisms in the regulation of the tone that's associated with balance between parasympathetic and sympathetic nervous system function. Now, there's one other part of this story that's emerging as well, which I think deserves our attention as we're really looking clinically at how best to manage these imbalanced states of low HRV associated with sympathetic drive. And this has to do with the connection between the gut microbiome and the nervous system, immune system connection through the vagus nerve. Remember when I showed you the diagram of all the places that the vagus nerve stops on its way down from the spinal nerve down to the remainder of the body, that it does so by very significant innervation and connections with the gastrointestinal tract. So it's picking up information all the time from the gastrointestinal associated lymphoid tissue, and then signaling back to the brain, and the brain is then signaling forward with signals as to whether it's under alarm or it's under a state of balance. And under alarm, then that alters then the sympathetic tone versus parasympathetic tone, and now we get into an inflammatory drive. So this microbiota gut-brain axis is now receiving a lot more attention as it relates to the signals that the microbiota in our gut are sending to the vagus nerve back to the brain and altering the balance between the sympathetic and nervous system, parasympathetic nervous system function. So it involves pathways such as the autonomic and enteric nervous system interrelationship and how that interconnects with the hypothalamic pituitary adrenal axis, which then, as we know, downstream regulates through this network the immune system activity and enteroendocrine cells that line the gastrointestinal tract. These are like the different cells that have receptor sites for release then of enteroendocrine hormones like GLP-1, ghrelin, other members of that family, including serotonin and its relationships between peripheral and central nervous system function. And all of these things are then tied in part to the status of our microbiome. Are we dysbiotic? Does a person have dysfunctional bacterial information or metabolites from certain parasitic bacteria that are influencing then this network in such a way as to produce arousal, ultimately leading to inflammation? So this paper goes on to say that because of the enteroendocrine cell-mediated interaction with the gut microbiota, the vagus nerve provides a potential pathway which gut microorganisms can influence in host behavior and metabolic control, both normal physiologic and pathologic conditions. So we should put the gut and the microbiome into our clinical spotlight as it relates to vagal nerve tone and the balance between sympathetic and sympathetic nervous system function as well. All part of this emerging story as to how we actually can start to restore balance in a state of imbalanced cortical function. So the microbiota gut-brain axis shares a very important relationship to vagal nerve tone that interconnects with things like diet, appetite, obesity, insulin sensitivity, type 2 diabetes. All these are interconnected through the enterochromatin cells in the gut, through the HPA axis, and the effects on the gut microbiome axis. So all these are interconnected in this new emergent, I would call it functional medicine systems biology recognition of the interaction of these one with the other. So the microbiota gut-brain axis, the hepatic, vagal afferents, and all these interrelationships to multiple organs, like you think about non-alcoholic fatty liver disease. It's associated with deposition of fat into the liver. Where do the signals come that induce those effects, those metabolic disturbances that ultimately lead to lowered resilience and increased dysfunction? We go back again to this important interrelationship between the microbiota gut-brain axis. So it's a metabolic as well as an immunological, as well as a neurological, as well as an endocrinological impact when we're talking about the important role of vagal tone and vagal function. So the communication of the gut microbiota and brain versus immune and neuroendocrine signaling is now becoming a much better recognized target for intervention. And that's why we think that this topic is so timely about vagal nerve stimulation, restoring vagal tone, restoring, therefore, the balance between parasympathetic and sympathetic tone, and the impact, positive impact it has on neurological symptoms, depression, mood swings, sleep disturbances, and immunological conditions associated with pro-inflammatory states, all interconnected. So the interception of microbial metabolites from the small intestine then can directly affect vagal nerve function, or can indirectly affect through signaling through the brain and induce then these changes. So I think that we lastly say, can diet play a role in modulating these effects along with transcutaneous vagal nerve stimulation? And the answer is yes. It's multiple shots on goal. There's now evidence to show that flavonoids in the diet, these plant nutrients, of which there are literally thousands in our diets, if we consume plant foods, that is, that they play very important roles in reestablishing balance in vagal nerve tone through the interrelationship they have with the microbiota of the gut. And this is a recent paper really looking at these interrelationships between vagal nerve regulatory intermediates and plant-derived flavonoids and how they get processed through the microbiota of our gut into these messenger molecules that establish aspects of vagal tone. So this is a very important therapeutic series of tools that we're developing that has to do with vagal nerve stimulation, transcutaneous, coupled with the dietary and lifestyle intervention strategies to reestablish the balance between parasympathetic and sympathetic function. So in conclusion, as an introduction to this topic, and you're going to hear much more detailed news to use therapeutically from our clinical experts in a moment, but I would just urge the recent book by Dr. Habib, which I think is a really good overview book, probably suitable for patients on this topic. Upgrade Your Vagus Nerve has some really important news to use overview of people who are not familiar with this topic. But I think we can state with some degree of surety now, as we move into this particular topic with our experts, that the balance of parasympathetic and sympathetic tone is a critical objective in achieving resilience in our patients. The vagus nerve plays an important role in regulating parasympathetic and sympathetic tone. That the vagus nerve function is influenced by stress, dysbiosis, xenobiotic exposure, and inflammatory triggers, and vagus nerve stimulation using transcutaneous stimulation has been shown to improve immunity, reduce inflammation, and improve cardiometabolic function. So a wide variety of payoffs clinically from understanding this emerging science. So with that, let me stop my share here. And what we will do is we'll move our discussion now over to our clinician experts, and then I'll remind you that we'll get back together for a panel discussion at the end. So thanks for being with me, and I think you're going to find a tremendous value out of the presentations of our presenters. Talk to you soon.
Hello, I'm Peter Stotz, co-founder and chief medical officer of electroCore and chairman of the Vagus Nerve Society. I'd like to welcome you to our conversation today about pain, inflammation, and the vagus nerve. My central tenet today is that the vagus nerve is very important in controlling and modifying multiple different disease states. Today, I hope to speak with you briefly about the anatomy and physiology of the vagus nerve, explore how the vagus nerve controls inflammation, and importantly, how vagus nerve stimulation decreases inflammation and the inflammatory response. And it may not be so obvious, although this audience probably does understand it better than most, why controlling inflammation is important across multiple disease states, both in acute and in the chronic inflammatory diseases. So let's get started. The vagus nerve is also known as the 10th cranial nerve. It's been called the wandering nerve, and you see on the picture on the right here, the course of this nerve, it really wanders throughout the body, goes to the pulmonary tree, goes to the cardiac, goes to the gastrointestinal tract, and really does control quite a bit of brain function as well. There are both motor and sensory components to the vagus nerve, and it's primarily associated with the parasympathetic system. The vagus nerve affects and then in return controls the brain, but it controls and is affected in many different organ systems, predominantly the thoracic and abdominal organs. Now, just a brief set of anatomy, because people hear different things about the vagus nerve, that the vagus nerve originates up in the medulla oblongata. There are 2 sensory ganglion as it exits the jugular foramen, and then it traverses down the neck within the carotid sheath and breaks off into 4 different branches. the pharyngeal branches, the superior laryngeal branches, the recurrent laryngeal nerve, and the superior cardiac nerve. These are some of the more conventional things that we think about. But there are approximately 160,000 fibers that are occurring in that carotid sheath that travel down the neck on both the right and the left sides. The vagus nerve has a number of important physiological functions. If you're like me, you knew that the vagus nerve was important and probably important in causing bradycardia or slowing of the heart rate or something to that effect, but weren't quite as familiar with all of the different things that the vagus nerve does. I read today a nice paper in an animal model about how vagus nerve controls nociception. It affects cortical spreading depression. It actually increases brain modulation effects that we will talk about, but also increases and improves the inflammatory response. It can, as I mentioned, reduce heart rate and blood pressure. It does improve bronchodilation, so it helps you breathe better. It can regulate gluconeogenesis. As part of the function includes both liver control as well as pancreas control. It can control GI motility, satiety, and else pain and GI function generally. And importantly, it controls inflammation. We didn't used to really appreciate how important the spleen was in controlling the inflammatory response. But there is a branch that goes to the spleen that controls inflammation, and that is really, really important. Now, there are different methods of stimulating the vagus nerve. You've heard of William Hoff, who is known for submersing himself in cold water. There are deep breathing techniques, there's yoga techniques. The polyvagal theory and approach has the safe and sound protocol. All of these are natural methods of stimulating the vagus nerve. And I should just say as an aside, I'm a fan of all of these in things that you can do at home by yourself to help with vagal nerve stimulation. There are very aggressive approaches like implanted vagus nerve stimulators. The main one that people are aware of are the cervical implanted vagus nerve stimulators. In this, you can see in the picture on the right, one cuts down to the carotid artery, opens the carotid sheath, identifies the vagus nerve, and then can implant a coil electrode. Typically is how it's done. It's something that wraps around the vagus and can stimulate the vagus nerve directly with an implant. This has been done since 1997 for epilepsy, and in 2005 the FDA had approved it for anxiety and severe depression problems. More recently, they have been working on getting CMS approval and other insurance approval for anxiety and depression, but right now this approach is pretty much relegated for seizure disorders. There were devices that were implanted on the fundus of the stomach to help control obesity. There are auricular vagus nerve stimulators that control about 1%. All of these fibers are afferent fibers that go to the trigeminal islands, but they have about 960 fibers there compared to the 160,000 fibers that are identified in the cervical branch of the vagus nerve. And then, of course, there is non-invasive cervical vagus nerve stimulation, which gets to approximately 100% of the vagal fibers, has the potential to get to all of these fibers, I should say. There are efferent and afferent fibers, so if you're trying to control directly visceral functions, the efferent fibers are really important. If we're trying to provide information to the brain, the afferent fibers are particularly important. Now, these fibers project to a slightly different area, to the nucleus tractus solitarius, and then there is very wide distribution after this complex is activated. Now, let's bring it back to inflammation. You know, we've known that inflammation is really important in health and disease, and a recent Time article talked about the surprising link between inflammation and heart attacks, cancer, Alzheimer's disease. I actually think it's going to turn out to be much, much broader than what's listed here. We know of inflammation being important in diseases such as Parkinson's disease, acute stroke, gastrointestinal problems maybe, well, certainly with disorders like inflammatory bowel disease. It's very important in rheumatoid arthritis, etc. So there are multiple different disease states that are impacted by inflammation. I tend to think of this as the software in a computerized system. We, of course, have the hardware, which is where most of Western medicine has been focusing. So if you're a cardiologist, you concentrate on the function of the heart, or if you're a pulmonologist, you know everything about the lungs. But what's frequently forgotten is the software. And the software is, in fact, the vagus nerve and its projections. So let's talk about that. Let's talk about how the vagus nerve controls inflammation. Now, this is relatively new, I should say. Over the last 20 years or so, we've started to it's 25 years, we've started to identify various ways of controlling inflammation. Now, inflammation is necessary. Inflammation is important in controlling disease states. So, for example, if you get a bacterial infection or a viral infection, you want your body to mount an inflammatory response to fight off that inflammatory or infectious disease. If you twist your ankle, your body wants to create an inflammatory response to help that area heal. But unfortunately, inflammation can get out of control. Think about the child with peanut allergies who can die from an exposure to an allergen here. And because inflammation is so strong that it can kill you, your body has developed 4 defense mechanisms to try to mitigate the effects of inflammation when it gets too robust. There are the SOX proteins in the top left-hand corner. There are circulating cortisol and corticosteroids, which you see in prednisone as one strategy here. And these are things, these prednisone strategies was something that everybody knows about. Everybody knows about circulating cortisol. There are anti-inflammatory cytokines. So there are some cytokines that fight the pro-inflammatory cytokines or offset them. And you see a couple of them listed here. But what's not really been recognized to the degree that it should is the autonomic nervous system. The autonomic nervous system is the command and control. It's what information goes to the brain via the autonomic nervous system, and then the brain in return tells the organ systems how to function and how to modulate inflammation via what's called the cholinergic anti-inflammatory reflex. And I know I'm not going to do it justice here because it is much more complex than what I'm saying. But for the purposes of our time today, I want to talk a little bit about how it was discovered and then very briefly how the vagus nerve controls the inflammatory response. Now, there were some very smart investigators. Kevin Tracy is a name that people generally recognize that worked on vagus nerve and inflammation. And if I draw your attention to the little box here in the middle here, they started with giving an animal lipopolysaccharide. And if they gave no lipopolysaccharide, that's the negative circle here, so I'll show you right in here, and you don't do anything to the vagus nerve, you really have no change in TNF-alpha, one of the pro-inflammatory cytokines that we talk about. If you give the animal lipopolysaccharide and do nothing to the vagus nerve, you see a robust increase in the TNF-alpha, jumping up from 0 to about 12 or 13. If you do a vagotomy on the vagus nerve and you cut the vagus nerve, you actually increase that TNF-alpha a little bit more. And then finally, if you stimulate the vagus nerve, you will cause a decrease in that production of TNF. So it's really an important finding. And it was summarized as the cholinergic anti-inflammatory pathway. And there is a branch that goes up to the brainstem. And in response, what I'm showing you is the efferent branch, is the vagus nerve connects to the celiac ganglion. There is a noradrenergic release of norepinephrine that goes from the celiac ganglion to the T cells. The T cells activate the beta-2 adrenergic receptor, and the T cells then release acetylcholine. Acetylcholine Unfortunately, my face is covering this here, but acetylcholine can modulate macrophages, and macrophages can inhibit and cause a decrease in the production of these pro-inflammatory cytokines. So not as well recognized as it should be that this is so important in controlling inflammation. It is neural control of the inflammatory response, neural control of the immune system. So we're going to talk a little bit more about how this happens and why that's important in various disease states. It has been studied in rheumatoid arthritis, Sjogren's disease, gastrointestinal disorders, primary headaches, post-traumatic stress disorder, Parkinson's disease, stroke, mood and attention, long COVID, and acute COVID. So these are some areas that we're going to talk about very briefly on how the vagus nerve is impacting these different diseases. Let's start with rheumatoid arthritis. Now, the same group that was looking at vagus nerve stimulation in that animal model also wanted to look at it in human clinical conditions. And they started looking at rheumatoid arthritis. And the first of the series of studies that was done was actually a very exquisite study. And I'm going to draw your attention up to the top here. They looked at, and I'm going to show you two separate factors here. First is the TNF alpha in relation to the vagus nerve stimulation, and the second is function. And decreasing this line drawing down here shows an improvement in function. When it goes back up, it's a decrease in function. It goes back down, it's an improvement in function. And what they did here was they got a baseline set of scores, which you see minus 21 here, and out to time 0. And this TNF alpha is relatively high in this population with rheumatoid arthritis. At time 0, they turned on and implanted vagus nerve stimulation. And you can see a reduction by day 42 of TNF alpha. That is that same time point where you see a complete reduction going on over here in the improvement in functional scores. Now here they turned off the vagus nerve stimulator and watched the TNF alpha start to rise back up again. And you see the function rising back up again. And then they turned it back on and you see the function improving again, and you see TNF alpha falling down again. So really it's a nice proof of principle study. This was a small number of patients who had failed biologics with rheumatoid arthritis, open label trial effectively, but really important demonstration in a pilot approach that vagus nerve stimulation can control inflammation. Now there's a lot of advantages of a strategy such as this. One doesn't have the toxicity of some of the biologics therapies. I think this works potential it has to work particularly well. But the disadvantages of this approach was an implanted vagus nerve stimulator carries the risk of surgical approaches, which are higher than what you see with the non-invasive approach. There are multiple different anti-inflammatory pathways. There's a branch that goes to the cardiac, liver, as I mentioned. There is the gastrointestinal tract, and there are efferent branches. I mentioned that the spleen has one particular cholinergic anti-inflammatory pathway, but it turns out there are several anti-inflammatory pathways. And we're going to switch to one that has been identified in the bowels, the inflammatory bowel disease. In this one, it's a little bit different. The vagus nerve goes to the mesenteric plexus here. The branches on the myenteric plexus, can modulate via similarly alpha-7 nicotinic receptors on the macrophages, causing a reduction, as you see here, of various pro-inflammatory cytokines. So a similar idea. Now, when you start to think about this, that there is this significant response of the vagus nerve in inflammation, and you understand that it's also on the myenteric plexus, one begins to understand that there are diseases like IBD that could potentially be treated. And Bruno Bonaz did the study looking at that in patients with IBD. Again, very sick patients who had failed biologics, 7 patients who were implanted with a vagus nerve stimulator. And by various metrics, all 7 patients had either almost or complete reduction in to baseline or return to normal with an implanted vagus nerve stimulation. Again, another pilot study, not a double-blinded RCT, but this is a very debilitating disorder that, frankly, many patients' option at this point is to have their bowel resected. So, really does suggest that we should be rethinking disorders such as inflammatory bowel disease and our treatment strategies to include the software system of the vagus nerve. Other gastrointestinal areas have been looked at. Linda Wynn from Stanford did a small pilot series in patients with gastrointestinal problems. Jay Pashrika from Johns Hopkins, now the Mayo Clinic, has done a similar study looking at autonomic measures. There's a large trial ongoing in Denmark. So there are a number of different aspects, but all of them seem to be pointing towards vagus nerve stimulation being a potential avenue for gastrointestinal disorders. And here's Linda's work, Dr. Wynn's work, looking at pre-established nausea, vomiting, fullness and satiety, and bloating and pain. So without vagus nerve stimulation, the numbers are as you see here. With vagus nerve stimulation, there is a significant reduction. And the aggregate measures you can see over here on the left as well. Now, many of you have heard of COVID. COVID-19 hit, and just this week I learned that the patents were issued on vagus nerve stimulation in modifying a viral disorder and inflammatory response and a bleeding disorder associated with COVID. And we had suggested this as a possibility back in early 2020 when we saw that what was killing people was not only the pulmonary problems, but also the cytokine storm. I've spent most of this conversation talking about the inflammatory response or the cytokine reaction, but it's important to note that there are other aspects of vagus nerve stimulation that work via different mechanisms to improve bronchodilation, and this is why the FDA had granted an emergency use authorization to help with breathing due to a COVID for known or suspected COVID way back in July of 2020. We did do a study with Carlos Ternero leading the study, looking at non-invasive vagus nerve stimulation. We called this the Savior 1 trial. And we looked at a variety of different factors in about 100 patients who were treated with non-invasive vagus nerve stimulation or standard of care in patients admitted and hospitalized with vagus nerve with COVID. And what you can see here is that there was a significant improvement in at both 5 days as well as overall in patients who had in their C-reactive protein, returning back to a baseline of less than 10. You can see the dramatic improvement in the group that was treated with vagus nerve stimulation back, close to 50% of patients versus less than 20% of patients were back to normal within a few days of treatment with VNS, and this was compared to standard of care. Also, interestingly, D-dimer appears to be improving, and D-dimer is one of the metrics that we look at to see if one's in a hypercoagulable state. And we did learn during COVID that a number of people developed blood clots. It was probably due to the inflammatory response, is my perception here, and VNS seems to normalize it, although it looks significant, did not hit statistical significance. There's quite a bit of variability here. And breaking it down, we could see by disease severity, it appears that IL-6 was impacted in the moderate patients, FiO2 in the more severe patients. D-dimer, you can see here in the overall and the severe patients all appeared to be impacted, and procalcitonin also impacted on day 5. So overall, this is a very interesting novel approach to treating a cytokine storm associated with a viral infection. So let's talk a little bit about the afferent pathway. We talked a little bit about the efferent and inflammation, but it also reduces inflammation centrally. So inflammation centrally is important in a variety of different disorders. I believe it's important in epilepsy, clearly in headache disorders, it's important. Parkinson's disease, Alzheimer's disease, there are a variety of areas associated with inflammation in the brain. Traumatic brain injury would be another one, stroke would be another one. All have been shown to have inflammatory responses in the brain. And the question is, can we use non-invasive vagus nerve stimulation, taking it away from the surgical approach, to modulate inflammation in patients with undergoing any number of different traumas? And what was identified is that that vagus nerve stimulation compared to sham significantly is improved. Take a look at IL-1 beta here compared to the sham with a model of inducing neuroinflammation. You can really inhibit it from ever happening, as you see here. And this was in an animal model, but it's also been identified in human patients as well. And I'm not going to go through all of the data on headaches. That's a completely different topic, but this does correlate with improvement in headaches. There are now 6 different FDA clearances in primary headache for cervical non-invasive vagus nerve stimulation, particularly with the gamma cord device, where I should say frequency matters, and how they're actually delivering this really does matter. But we can decrease the number of headache days and the number of migraine days in patients with migraine. It's also been shown to be effective for cluster headaches. And frankly, in Europe today, NICE now covers this for cluster patients because it's not only effective, but it's cost dominant. And you can see here some of the studies that we conducted at electroCore in various types of headache disorders, acute cluster prevention, migraine, acute and prevention, adolescent migraine. You can see a number of the different studies that we have invested in over the years, and it is probably the most studied medical device out there for headache disorders, with the most number of FDA clearances in the headache space. And this has been recognized by Health and Human Services. Health and Human Services has put together the best practices for pain control. This was all in response to the 2016 guidelines that came out, limiting the amount of opioids that a patient should have. And they looked at various options, and one of the options here was cervical non-invasive vagus nerve stimulation, and referenced a number of the studies that we had participated in trying to help patients with headache disorders. Parkinson's is another area of great interest. Double-blind randomized controlled trial looked at, with a crossover design, looked at cervical non-invasive versus sham. And I'm going through this relatively quickly right now for time's sake, but they saw improvement in velocity, step length, and importantly, improvement in TNF alpha. They showed an improvement in glutathione, which you can think of as a scavenger, and BDNF, which is a neurotrophic factor. So lots of really interesting and intriguing early data on Parkinson's disease. There's a second study coming, but this one demonstrated this improvement in the inflammatory response. PTSD, great work by Doug Bremner and another group, Emmanuel Lehrman at UC San Diego, are doing work on PTSD, a number of studies. But one of the areas that they looked at was inflammatory marker of IL-6. And you can see here the study design, 3 months of treatment, non-invasive vagus nerve stimulation versus sham, with a follow-up period of another 3 months of NVNS. And they showed an improvement in the PTSD checklist scores, but also I must have deleted that slide. They showed an improvement in IL-6 as well. Another evolving area is stroke. Stroke's incredibly important and not as well understood as we would like, but I could tell you that there is a modification of inflammation that occurs during an evolving stroke. And this seems to correlate with improvement or the size of an infarct volume. So if we can, in this model, what was done by the group up at Harvard is they created a consistent model and looked at the infarct volume size. And they showed that with transient middle cerebral artery occlusion model, you could decrease the size of the stroke by close to 50%. Really remarkable finding if we capture it early. And you have to really, in this group of studies, do it within 4 hours. But the group up at Harvard also led a study in Turkey looking at vagus nerve stimulation in humans in acute stroke. Really, animals are great, but what's really relevant is how can we address this in humans. And I will just show you that sham from the onset of the size of the stroke for a 24-hour period, what looks at the evolution of the stroke, sham had an increase of 185%, low dose had an increase of close to 100%, and high dose vagus nerve stimulation only had an increase of about 63%. So a significant improvement over sham on infarct volume. A second study is being done right now in Leiden, and we are anxiously awaiting the results of this study in humans as well. Traumatic brain injury, another great area. It's similar, has been shown to have an improvement almost back to baseline with a blast injury as well as a weight drop model. I'm not showing you here, but both of these different studies are really quite interesting and could potentially show an improvement in the size of an injury, a traumatic brain injury. And it makes you think about sports as well as our military, car accidents, that if we capture it early, we may be able to decrease the size of brain injury. The NFL is coming around to this, and they're funding a study through the American Society of Pain and Neuroscience, really at this point looking at post-concussion headaches. But at some point, we're going to look towards prevention in a model of traumatic brain injury. So I'm going to end with just a couple of important and paradigmatic thoughts about this. Inflammation is important, and it's a central process across multiple different disease states. The vagus nerve controls multiple organ functions, particularly inflammation within those organ functions. I did somewhat cherry-pick data. There are other effects. There are neurotransmitter effects that are incredibly important. But the purpose of today's talk was to talk about inflammation. And finally, vagus nerve stimulation can decrease the inflammatory response to more of a baseline normal state. So this is something that we should be thinking about in our clinical practices, and most importantly, in our further evolution of the science around vagus nerve stimulation. I should be very clear that what has been approved by the FDA to date is treatment in various types of primary headache, such as cluster and migraine, from an FDA perspective. But I was trying to give you a sense of the science of what's going on and my predictions about things that we're going to be addressing in the future with vagus nerve stimulation. Thanks very much. I appreciate your time and attention today.
Hi, everybody. This is Dr. Habib, and I'm really excited to be sharing some clinical approaches to improving vagal nerve tone. I want to do a little bit of anatomy review, and then we'll get into what vagus nerve tone is, and to fully understand how we can identify vagal tone issues in our patients when they come in to see us, and what we can then do about it as practitioners with our patients. So we'll start off with a basic overview of the vagal cholinergic anti-inflammatory pathway. As you can see, vagus nerve located right over here. has direct connections in the brainstem to the nucleus tractus solitarius as its afferent pathway, and the efferent pathway through the dorsal vagal motor nucleus or dorsal motor nucleus of vagus. Okay, there are two more nuclei that vagus nerve does have connections to, but these two are the primary parasympathetic drivers of information through the body. And the vast majority of information is actually coming up to the nucleus tractus solitarius. Approximately 80% comes through the vagus nerve upward from all of the organs that it innervates to then provide information to the central nervous system via the nucleus tractus solitarius. There is some processing that occurs here, and there is some actual control over the hypothalamic pituitary axis, the HPA axis. And this is where a lot of the inputs actually come in to the hypothalamus to then provide information as to, do we need to provide cortisol? Do we need to increase glucocorticoid activity or not? Do we need to produce corticotropin releasing hormone or ACTH through the pituitary? This is actually where the inputs come in. So this is a really important piece to that puzzle, particularly for those practitioners who are focused on hormones. We can't forget that the vagal innervation is required to provide that information, that sensory input, to then dictate what we want to do about it on a hormonal basis. So this is important to understand. On the efferent pathway, we've got the dorsal motor nucleus of vagus sending information down. Probably about 15% of information is efferent in this pathway. And we have direct innervation to certain organs, particularly most of the viscera is getting a direct innervation, particularly the gut, small intestine, the ascending colon the ascending colon component of the large intestine. And we do have a very particular and important link to the spleen. So there is a branch of the vagus nerve that goes to the celiac superior mesenteric ganglia. And the celiac ganglia, we have a release of acetylcholine occurring here. And the acetylcholine then activates the splenic nerve. And the splenic nerve normally is a nerve that is sympathetic in nature. So there actually is, it's part of the sympathetic chain ganglia over here. And we actually have vagal innervation here to shut down norepinephrine production there and actually create a release of norepinephrine at the spleen. And this activation of the spleen attacks or hits certain type of cell. These are T cells located in the spleen here. And these T cells, CD4 plus T cells, have beta-2 adrenergic receptors on them. And the norepinephrine tells them that they need to go out and send more acetylcholine to the tissues that are present that aren't directly innervated to the vagus nerve. Okay, so now we have acetylcholine being released by these T cells. These cells are known as CHAT cells, cholinergic activating T cells. And so these T cells go and release acetylcholine to all of the splenic and local tissue macrophages, activating the alpha-7 nicotinic acetylcholine receptor and down-regulating the inflammatory cytokine activity, down-regulating inflammatory cytokine release. This is how we control inflammation. We also have a direct pathway through the hormonal pathways here, as glucocorticoids will have similar effects, but we can't have, obviously, excess cortisol will down-regulate this. So we want to make sure that there is good balance. It has to be a synergistic effect from vagal innervation, sending out the acetylcholine to these local tissue macrophages, tissue resident macrophages, as well as the CHAT cells going out and sending it to the rest of the tissues that don't have direct vagal innervation. Okay, this is the overall pathway of the cholinergic anti-inflammatory pathway. Now, what is vagal tone? Vagal tone simply states just how strong is the nerve at, or how willing or how capable is the nerve in being able to send out the acetylcholine and get it into those postsynaptic areas, both in the celiac ganglion, in the local tissues, and via the CHAT cells as well. And so how well are we able to send that signal? How strong is the vagus nerve in being able to get that acetylcholine out to activate that control of inflammation? you can see very clearly when we don't have vagus nerve function through vagotomy or through very, very low function here, this leads to an inflammatory activation. And when we have good, strong cholinergic tone, we actually have tolerance, we have resilience, we have the ability to control the inflammatory signaling and maintain homeostasis within the rest of the body through the production of anti-inflammatory cytokines. All right. A really simple way to understand this, we've got these macrophages, M0 macrophages at the top, the blue guys. And depending on the signals that come in, whether lipopolysaccharide or IFN gamma, these are going to get pushed towards a sympathetically activated fight type of macrophage known as the M1 macrophage. M1s like to fight. These are pro-inflammatory. They're necessary to fight against some of the triggers that might be coming in, the threats to our survival. We need to have them. We need them functioning. If the signals coming into the M0 are IL-4, IL-10, anti-inflammatory cytokines, then we're going to increase the number of M2 macrophages. And these M2 macrophages are known to be the fixed macrophages. And these can be further classified down into M2A, 2B, 2C, and 2D based on the signals that are coming in. And these will have a very particular effect on whether they're going to be more debris removal, regulatory, or pro-angiogenic in their function. There is one really missing piece to this image, and I wanted to add it in here because as we increase the number of M2 macrophages, we inhibit the production or the activation of M1 macrophages, and we have a very particular path that we're able to upregulate from M1 to M2, and that is through the access of acetylcholine and vagus nerve stimulation or vagus nerve cholinergic tone. What we're really looking to get is the acetylcholine release being the biggest piece to this puzzle, okay? Because acetylcholine release is going to trigger these fixed macrophages. So we go from a pro-inflammatory to an anti-inflammatory or controlled inflammatory state. There are some clinical pearls I would love for you to understand as we go through this entire process. The first is to look for physical stress. Look for a history of whiplash, concussion, surgical trauma, vascular or meningeal injury. These can be very, very overlooked and have a very important role to play. Whether there was a car accident that this person experienced 10 or 15 years prior and slowly went downhill from that point onwards, those shearing forces from a car accident, from a whiplash type of injury, the shearing forces actually go through the brainstem quite often, and we create an autonomic type of concussion or autonomic whiplash type of injury, and that actually creates a shearing force at areas like the nucleus tractus solitarius or the dorsal motor nucleus of vagus. So the vagus nerve root at the brainstem can be injured through these physical stressors and needs to be assessed in the past history of your clients. Another physical stressor that we need to look at is breathing capacity. We know that sleep apnea rates are going up significantly. We also know from being functional integrative practitioners, we can see when our patients are not breathing effectively. And more often than not, people are breathing very, very poorly. Breathing capacity, your ability to breathe effectively, slow, diaphragmatic, nasal breathing is missing these days. And this is a big contributor to autonomic dysfunction and is a major physical stressor that can affect vagus nerve tone significantly. One that I don't really need to get into depth of, but we know that biochemical stress from dietary sources is a major, major trigger for vagal nerve dysfunction. We know that basically any diet that's high in excess calories, period, whether carbohydrate or fat, actually impair vagus nerve signaling of satiety. We know satiety is important here because GLP-1, this molecule that we're now all hearing about because of its presence in pharmaceutical and into the mainstream, GLP-1 is signaled through the vagus nerve. We get these signals at the stomach, we get these signals in the intestinal tract of the presence of this feeling of satiety. And satiety needs to be signaled up to the brain. That signal comes through the vagus nerve. If we lack vagal nerve tone, we are decreasing our ability to send that signal of satiety up to the brain, allowing for us to eventually stop feeling like we need to basically stop eating. Essentially, that feeling of satiety can be missed if vagus nerve tone is down. Another area of biochemical stress, one that I really don't need to get into the depth of, is dysbiosis. We've heard about this. We know many practitioners. We know tons of research is coming out on the microbiome and the presence of bacteria, viruses, yeast, parasites, worms, both that should not be there, and the lack of the good guys, the lack of those keystone and commensal bacteria needs to be addressed. A huge interesting one that's coming up in my practice quite a bit is the presence or the lack of Akkermansia muciniphila, which we know is the counteract to the goblet cells to produce the mucus barrier in the gut lining. And guess what? Those goblet cells get acetylcholine release from the enteric nervous system secondary to vagal innervation that then signals them to produce that mucus, the mucosal barrier. So the mucus needs to be produced by these goblet cells, and acetylcholine is required to help create that effect or create that that in counteract to Akkermansia. So we know that dysbiosis is going to play a huge role here. This is a really wonderful article by Bruno Bonaz and colleagues in regards to the vagus nerve at the interface of the microbiota gut-brain axis. So really important stuff here. One last area of biochemical stress we need to assess for is detoxification. We know that the liver is under attack in our North American kind of diets and lifestyles. And we know that there is a very clear signal or a very clear sign that the increase in pathogenesis and progression of non-alcoholic fatty liver disease is quite severe recently. And what this is telling us is there is an autonomic link to this. Hepatic autonomic nervous system and neurotrophic factors regulate the pathogenesis and progression of NAFLD. This is crazy because we actually have these Kupffer cells in the liver, and the Kupffer cells are the tissue-resident macrophage in the liver. These cells are necessary to help maintain homeostasis. They need to be in that M2 regulatory state. But as we continue to add more and more toxin in, as we continue to add more and more toxic burden to our liver, these cells get pushed into an M1 state. And what ends up happening is the deposition of this fat tissue in an organ that shouldn't have excess deposition of fat tissue, leading to non-alcoholic fatty liver disease, and eventually NASH, and eventually full-blown cirrhosis. So we don't want to go down that path. And what we need to do is start understanding that vagus control here helps to regulate whether we're in that M1 or M2 state for those macrophages. One last area I want to look at for stressors that can trigger vagal nerve tone issues is excessive emotional or psychological stress. And this is when we look at people having either childhood traumas, people having been victim of a crime, having gone through some serious emotional or psychological stressors that played a really important role in lowering their capacity to handle stress in the future. This should be at the top and at the forefront of everything that we're looking at when we're talking about our patients and their history, when we're trying to figure out what happened, especially in those timeline works that we can do during our assessment. I love timelining out when a stressor occurred and when symptoms might have started, whether it might have happened 3 months after, or it happened on the anniversary of something occurring, that challenges started occurring. And so this is an important one to not skip over when you're in practice talking to your patients. So make sure you're looking for potential triggers from an emotional or psychological stress perspective. Okay. So how can we measure the function of the vagus nerve in a clinical setting? The way that I like to do this is ideally through the use of heart rate variability. Now, heart rate versus heart rate variability, this discussion could take a long time. I'm going to do a very basic overview. Heart rate is simply the number of beats per minute. Very, very simple. Heart rate variability looks at the amount of time in milliseconds between beats of the heart. And what we're looking for is not to be too rhythmic. If we are too rhythmic, it's almost like our heart is beating on a metronome, and that metronome is happening at an exact pace or as close to an exact pace as possible. That tells us that we don't have autonomic inputs from both sympathetic and parasympathetic. It means we don't have good, strong respiratory sinus arrhythmia, and it means we lack resilience. We lack the ability to shift state from sympathetic to parasympathetic readily. And so heart rate variability is a sign. If we have a good amount of variability, meaning the number of milliseconds shifts quite a bit between beats of the heart, that tells us with greater certainty that these patients have more autonomic resilience and they have signals that are good and strong through the vagus nerve as well as the sympathetic nerves. Those are important here to understand. So the difference between heart rate and heart rate variability is very, very important to understand, because two people can have very similar beats per minute, but very, very different variability between these. And variability is that direct sign of the physiological arousal and resilience towards those challenges. And what we live in is a time where HRV tracking is available to us all the time. I've been tracking mine for years, and there are so many devices and so many tools out there that we can start to use these. I will recommend, do not get tied to the exact number of the HRV that's being tracked, whether from one device or another, and be absolutely certain not to compare one device to another, because they all have very different measurements in different areas, whether finger, whether on the wrist, whether on the chest. They all have different ways of measuring and different ways of algorithmically coming up with what that, or calculating the HRV measurement. So don't compare between devices. What I'll recommend is, if your patient is using a device, wonderful. If they need to use a device, recommend one that you feel comfortable with, that they can use on a regular basis, and implement that. You're simply looking at what their average is and trying to increase that average over time. That's an important factor here clinically when we're working with wearable devices and the use of inconsistent devices across the board. So here are some clinical recommendations to help upgrade the function of the vagus nerve. Number one, we need to start using the control of breath. Breath is the simplest and single most effective way in which to control our autonomic function. If you watch our patients breathe now, I do this simple tool with them where I have them put one hand on their chest, one hand on their belly, and take 3 deep, slow, controlled breaths. And what we tend to notice is that more often than not, they're breathing with their chest, and more people are breathing with their mouth than they realize. And they're often breathing very quickly, a very quick 1 or 2 second inhale, 1 or 2 second exhale, and they're breathing at a pace of 15 to 16 breaths per minute. That is a lot. We need to slow it down. The respiratory sinus arrhythmia is literally the change that occurs in your heart rate and heart rate variability based on if you are doing a current inhale or exhale. So inhaling actually increases sympathetic nerve activity and speeds up the heart rate, while exhaling tends to slow down the heart rate and pushes us into a vaguely activated parasympathetic tone. So what this means is we need to hack this. We need to figure out that when we have shorter inhales and longer exhales, that we are going to improve vagal nerve tone, that we're going to improve vagus nerve function. And we're going to train the vagus nerve to stay on longer, twice as long, in fact, if we do it in the right way, as the inhale and as the sympathetics. And what that means is, on a basic overall kind of control of this, we're sitting in a parasympathetic, vaguely activated state more than we are in a sympathetic state. And we're helping to train our body to get into that rest, digest, and recover state far more readily. So this is the importance of the breath. A very simple tool that I like to recommend is 4-7-8 breathing. So 4-second inhale through the nose. Nasal inhalation is a no-brainer and needs to be the only way that we inhale ideally. We need to hold then for 7 seconds, and the inhale needs to occur to the diaphragm. We should not be breathing into our chest as the primary area. So I have my patients, like I said, a hand on the chest, a hand on the belly, and I make sure that the breath as they're coming in comes into the belly. With my kids, I get them to imagine that there's a balloon in their belly and they have to blow that balloon up. It can be a particular color or have a specific Disney character on it, but that's really one of the great tools that we can utilize to make sure that this process is effective in visualization and get us into a state where we're blowing up that balloon in our belly first before any of the accessory breathing muscles in the chest are then utilized. The breath is key. Everything comes back to the breath, even cold exposure. So cold exposure is something that we've been hitting quite a bit. There's a lot of really phenomenal evidence that cold exposure is wonderful for vagus nerve tone and is wonderful for producing this vaguely activated state. The way it does it, and we have to be really careful to do this in the right patients. I don't give this to patients that are in significant stress or undergoing a lot of challenge. What I do is when somebody has figured out to breathe really effectively and they're doing well with their 4-7-8 breathing, this is the next step up. This is a next challenge. And so cold exposure can be cold showers, can be cold plunges, can be cryotherapy. What we're doing is we're putting ourselves into an immediately stressful environment and teaching our bodies how to handle the stress by controlling our breath when we're in that scenario. Visualizing a fire growing in the belly, focusing on diaphragmatic breathing, focusing our energy down to ensuring that we're feeling good and strong there. And that's really the way that we can utilize cold exposure when we're working with our patients to help make this system work just that little bit better. Okay. So this is a great way to level up on the breath, but the breath really is the key. As we increase on the exhales, we can also increase gargling, humming, chanting, singing. These are all great ways to vocalize, and vocalization is great for the vagus nerve as well. I also want to talk about something that's been really, really important in my practice, and that is cervical transcutaneous vagus nerve stimulation. And what we're doing is we're electrically stimulating the fibers, the vagal fibers that are anterior to the SCM muscle in the neck, or just behind the SCM muscle. If you just kind of move it behind slightly with 2 fingers, find your pulse, you're within a couple of millimeters of the vagus nerve. Vagus nerve runs alongside the carotid artery and jugular vein. So this is important, and that's why it's so easily accessible in the neck. This is where we can really get the greatest effect on as many of those vagal fibers as possible. We're able to activate both afferent and efferent vagal axonal fibers. So the information, both afferent and efferent, can be improved, and we can increase cholinergic or vagal tone through electrical stimulation. And what's really interesting, don't ask me, I wasn't there for the design process, but we have a lot less fibers on the left side vagus nerve than we do on the right. There's not really an understanding as to why. We do know that the right side does tend to innervate the heart, and the left side not so much, but good question as to why. So just be aware that there is a difference side to side. We are not symmetric beings by any means. The vagus nerve, like I said, is within the carotid sheath in the neck. So we've got the sternocleidomastoid muscle, we've got the scalene sitting just beside here. And if we kind of, with our fingers, come in and push the SCM slightly out of the way, just kind of give it a push up backwards, and we can feel our pulse, we're, like I said, within millimeters of our vagus nerve. So this is a really good way to visualize what we're trying to do when we affect this. How it works is it has been shown through fMRI to activate brainstem nuclei, specifically the ones that I talked about earlier, the nucleus of the solitary tract and the dorsal motor nucleus of vagus. We're able to get both afferent and efferent activation occurring here with cervical transcutaneous VNS. What it causes is a biphasic response. And I don't have time to get into this biphasic response at all right now, but fMRI studies do show this biphasic response activating the thalamus. And what we then get through a thalamic activation is improvements in these symptoms: sleep, emotion, arousal, plasticity, and memory. We're actually able to affect neuroplastic changes and really improve the way that patients are showing up, because they're getting their bodies into a rest and recover state. we're able to facilitate a state shift. Now, vagus nerve stimulation is not a treatment for any particular condition. It is a tool that facilitates a state shift. And what we're trying to facilitate is a shift from sympathetic fight, flight state into parasympathetic rest, digest, and recover. That is the key here. We're trying to shift towards rest, digest, and recover. Inflammatory to anti-inflammatory, sympathetic to parasympathetic, fight or flight to rest, digest, and recover. This is what we really need to be working on. A quick set of protocols for you to take home and utilize with your patients. Number one, start with slow diaphragmatic breathing. I recommend 2 or 3 times daily when they wake up, when they go to bed, 3 to 10 minutes, one hand on the belly, one hand on the chest, and focus on that 4-7-8 pattern, diaphragmatic nasal breathing, longer exhale than inhale. Cold exposure is a great way to add on to that breath. Beginners can shower with 30 seconds of cold water and then increase that time incrementally and focus on diaphragmatic breathing through that process. And lastly, advance to an entire shower or start to do a cold plunge for anywhere between 2 to 5 minutes. We've seen some really phenomenal evidence on cold plunge. The use of cold plunge once a week or even consistently a few times a week can be really, really beneficial in producing this anti-inflammatory state. And lastly, vagus nerve stimulation. I love using my vagus nerve stimulator devices with my patients, have them put it directly onto that spot where they find their pulse, turn on the device and let it run for a simple 2-minute stimulation. They can be a single 2 minutes or 2 2-minute stimulations done a couple times a day. We recommend doing it, bookending it with the beginning and the end of the day. Morning, if need be, in the midday and before bed. If they're symptomatic, midday is a good one to add in. And then what's really amazing is this can be used in some acute circumstances to really help calm our patients down. I truly hope that this has been helpful, and I'm excited to continue this conversation with you.
Well, here we are at what is for me one of those magic moments in our personalized lifestyle medicine education programs, and that's the opportunity to speak kind of spontaneously with our experts. And we have, as you can see from the program, 2 extraordinary experts in this area that we'll be exploring a little bit in this discussion. We're coming off of a really interesting experience. Dr. Habib and I were just back from New York City at the annual Integrative Health Conference, IHS, Integrated Health Symposium. And I was an attendee and a student wrapped with Dr. Habib's presentation, which was extraordinarily well attended. And I thought did a masterful job of tying many of these things that we're going to talk about, the 3 of us together. And one of the things that I thought was very, very important as a takeaway is the extraordinary breadth of clinical conditions that are impacted by and interrelated to functional status of the vagal nerve system. And I think those of us that are not students but not expert in the art are really have our eyes open as to the range of different important functions that are regulated or interrelated to the function of the vagal nerve system. One of the things that I had seen, which was kind of an aha for me when I was attending a rheumatology conference I was a presenter at some months ago, is one of the presenters was showing that the vagal nerve tone has a really direct relationship with the success of TNF-alpha blocking agents in individuals with arthritis, and that people that have very good vagal tone, as represented by better HRV, heart rate variability, are people who take less amounts of drugs to get clinical efficacy, and they have much better outcomes than people with low vagal tone or low HRVs. And so then that just brings in this whole question of the degree of the network biology of the vagal system and its interrelationship with so many different components of our immune, neurological, metabolic, and endocrine systems. And so it's it really makes this a very timely and important discussion. So with that, as a long-winded introduction, let me give each of you a chance to maybe give a few introductory comments about your experience since you put your program down and how we're going to cooperate in this this discussion. So, Dr. Habib, do you want to start?
Yeah, it's an honor, and thank you again for the opportunity to share. It really is, the vagus nerve is quite unique within the body. There's no other connecting point that unites the body in such an important way. And that's always what stuck out to me when I was initially learning about what it was. It was the anatomy in itself was so unique, the only cranial nerve to leave the cranial cavity and to have connections to such a vast number of organs directly. And then through all of the further research and learnings that I've gone through, understanding that it really is that the best way to put it is almost like a thermostat where it's gathering all the information as to what's happening within each of these organs, having that information sent up, processed within the central nervous system, and then creating that regulatory pathway to tell the immune cells, to tell the regulatory cells in each of the organs what we're doing, what's working, what's not, and should we be in a state that is allowing us to fight against a threat to our survival or to recover and repair from the damage that may have been done previously. And that for me has been the biggest eye-opener, just how important it is in interconnecting all of these systems that we tended to separate. This is really that uniting force for everything in what I've found in my research.
Yeah, beautifully stated. Dr. Stotts?
Yeah, very nice. Well, thank you. First again, thank you very much for having me. It's a pleasure to share the stage here with the two of you guys, such luminaries in our field. It's a pleasure. Thank you. You know, in 1934, thereabouts, Albert Einstein said that the physician of the future will be an expert in both the chemical as well as the physical side of medicine. And what he was referring to at that time is understanding the electrical aspects, those things that we're just now getting to almost 90 years later. I agree with Dr. Habib here that this is a great uniter, but I also think of it in a slightly different way. If you go buy a computer, you will have certain hardware on your computer. You'll have this great screen, you'll have a keyboard, you'll have a memory there. But if you don't have software, your computer doesn't work. And the vagus nerve and the interconnections in the brain is in fact that software. It is what drives our organ systems. So again, agreeing with Dr. Habib that we tend to be splitters in medicine today. You know, the heart cardiologist will see the heart. The psychiatrist will talk about anxiety. The neurologist will talk about your headaches. The gastroenterologist will talk about your GI tract. And we really shouldn't be splitters, but we should be lumpers, so to speak. And the lumping component of this is, in fact, the vagus. We will find that there are diseases. I coined the term about 10 years ago, vagus insufficiency syndrome, to reflect that there are these diseases that seem to clump together. Anxiety and depression, headaches, gastrointestinal problems, asthma, ironically, fibromyalgia, that can seem to kind of clump together. And we did a large statistical analysis to show that that's in fact true. And then when one stimulates the vagus nerve in somebody with headaches, for example, some of these other symptoms just melt away. And what I think we're finding is that you're not having a problem of anxiety or a problem of headaches or a problem of three separate problems. But in fact, what you're having is a problem of vagal tone. And that starts to take us into other directions as well. But when we have an adequate vagal tone, we are healthier broadly. And then the disease entities that tend to clump tend to get better. So long-winded answer to, this is a fascinating area. I think for a variety of reimbursement reasons and specialty-driven reasons, we have separated things out. And we are now coming back together to understand the interconnectedness, as you said, Dr. Habib, of medical disorders, health, wellness, and how the vagus nerve kind of overlaps via spider web everything.
That was beautifully stated. I couldn't imagine a better introduction to this interrogative among the three of us in your two comments. It really defines the whole nature of network medicine, systems, biology, and how it interrelates to functional disturbances. And it was brilliant, the two of you. I listed, I don't believe that it's a complete list, but I listed little categories going back to the splitter versus lumper discussion that you brought up, which I think is so important, but categories within the subcategory or the subheading of vagal network biological function. And those include the following categories. And I'd like us to actually go through and just put a pin in each of these. So here's my list, and it's probably, again, a big apology if it's not a complete list. So the vagal nerve system relates to physical function. So you have manipulative medicine, physical medicine that plays a role. You've got, and you just brought it up, Dr. Stotz, energy medicine. How does energetics engage in interaction with the vagal nerve system? We have the microbiome that obviously is a variable that plays a role in communicating with the vagal system. We have the interface then with the immune system, which is directly connected, well, maybe indirectly connected, but intimately related. We have, therefore, the metabolic components of the body that are interconnected through all the various metabolic, and then that ties to, obviously, the endocrine system. So we have an endocrine interrelationship to vagal nerve system. We know that stress physiology is extraordinarily engaged with a vagal physiological function. We know that nutrition and various nutrients and nutritional status play a role in vagal nerve system. We know now that certain botanical medicines interface with vagal nerve tone and function. We know that environmental medicine plays a role through exotoxins and various manipulators of receptors that participate within the vagal tone. And then lastly on my list, but certainly not least, is sleep biology and what we're starting to learn about sleep and its interrelationship with vagal tone. So that's not a probably complete list, but that's certainly worthy of discussion as it relates to the complex interface and universal impact that the vagal nerve function has. So maybe I would just ask each of you, you could pick your categories of interest, knowing we can't do all of them in completeness, but maybe you could pick a couple of those that I just went through that are most intimate to you and give a little insight into them. So, Dr. Habib, you want to start?
Yeah, that list is quite complete. I would say there may be a couple outliers, but the ones that really stuck out to me, and I kind of want to do a quick interplay and explain how vagus nerve is involved in so many of these different aspects. So let's talk about physical medicine first. That physical medicine piece is interrelated with fascia. It's how fascia allows for specific movements of muscles, the connection between the skin and the muscle interface and the bone. Vagus nerve plays an important role because there are macrophages present in that fascial tissue, in the muscular tissue, and having interaction through the acetylcholine and the cholinergic anti-inflammatory pathway, there's an important role there. In the physical medicine side, we can also look at the pathway of digestion and peristaltic motion, and it's vagus nerve innervation directly that enhances the enteric nervous system to then signal to the smooth muscle cells whether to promote the production of nitric oxide so that we have relaxation, or produce acetylcholine so we have contraction. And that allows for the physical motion and the movement of a bolus of food through each of the areas of the intestinal tract, physical and biochemical within there as well. As we get further into the digestive tract, we get to the microbiome, and this microbiome gut-brain axis is physically relayed information from all of these microbiota, the 100 trillion bacteria that live within the entirety of our gut system, having a relay of specific nutrients that are being broken down based on what we're eating, based on what's coming in through the gut, toxins that may be making their way in, which affects the environmental side of things. We have the microbiome that is important in creating and producing specific neurotransmitters, serotonin, dopamine, and acetylcholine as well, coming from the breakdown of foods within the digestive tract, and that being signaled up via the vagus nerve to the central nervous system. So that interplay is very important there. And on the metabolic side, a really important one that's obviously very relevant today, is the signaling of GLP-1, glucagon-like peptide 1, which we all now know because of these GLP-1 agonist medications that are out there. GLP-1 signaling is effectively going through the vagus nerve. And so vagal tone plays an important role on whether we're able to get that signal up to the brain to signal satiety, to signal whether we have this very important information coming in saying, yeah, you've had enough, and let's pause here, let's stop here, so that we can not overeat and not go into excess. And so that relay of information is really important. I love this interplay, and that's exactly how that uniting force of the vagus nerve truly works, and bringing together so many different pieces of the puzzle.
That's a fantastic explanation. So, Dr. Stotz, over to you. Where would you like to take this discussion?
Yeah, no, so I can't disagree with anything of my esteemed colleague just said. But what I would say is, if I were to take this answer in a slightly different direction, every disorder that I can think of right now is either caused by or exacerbated by inflammation. Cardiac disease, Alzheimer's disease, Parkinson's disease, post-traumatic stress disorder, anxiety, sleep disorders, working our way down, asthma, gastrointestinal problems, IBD. All of these problems, there's a central issue of inflammation. And what many people don't recognize is that your body has multiple different mechanisms of tamping down inflammation, but command and control is the vagus nerve. And so if you are going to get to, okay, I think inflammation is important, as we all do in our diets, that we talk about anti-inflammatory diets, we talk about this in terms of the microbiome, we talk about it in terms of our environmental factors. One additional strategy in lowering inflammation is activating your vagus. And so this is something that I think is a central and unifying principle in medicine today. I mean, I can't think of a disorder or a disease entity that is not affected by broadly the immune system, but narrowing it back down to pro-inflammatory cytokines causing problems for people. And so when I stop and I think about disorders that are associated with inflammation just about everywhere, I ask the question, can we make it better with vagus nerve stimulation? And similarly, we can ask the question about, okay, where has deep breathing, where has meditation, where has some of these areas that have been considered Western medicine, or not Western medicine, but Eastern medicine, that have actually been studied and have been demonstrated to have positive health benefits, where are they making inroads? That's where an area where I think the vagus nerve is probably involved and probably can make more inroads with a sophisticated approach to vagus nerve stimulation.
Wow. Okay. We've laid out some really great imperatives as it relates to the importance of the vagal nerve tone. And I'm thinking now about meditation. I'm thinking about relaxation therapy. I'm thinking about rewilding and moving into an environment that gets the background noise down, so your parasympathetic has a chance to express itself. So this cuts across so many different therapeutic areas of potential. So let's now talk about therapeutic areas. Now that we know we have an opportunity to have a master regulator, how do we help to regulate that opportunity? So let's go over to you, Dr. Habib, first. So take us through therapeutics. Where are we going to go?
Yeah, it's an important area. And so understanding what we can do as a therapy provider with our patients, with our clients, to have them look at what they might be doing in their lifestyle that isn't affecting them positively or is not allowing them to have good vagal tone as a foundational piece of controlling the inflammation that we now know obviously is that direct pathway to disease. So where I would always start, the ultimate answer from a foundation standpoint of is the vagus nerve working, is looking at the breath. Understanding that most often when people are breathing unconsciously, not breathing mindfully, not aware of what's coming in, what's going out, it actually is going to shift our body's state. And so controlling the breath really is important here. And what I'm talking about very briefly is if we're breathing with accessory or secondary breathing muscles as the prime drivers. And this is a learned but subconscious characterization of many people's conditions. Most people are breathing, especially those that are in an inflammatory state or in a sympathetic overdrive state, they're breathing with their chest. Often they're breathing through their mouth, and the breath is often very short and very shallow. And what we need to start to do is become aware of this. We need to become mindful of the breath patterns, using tools like simply putting a hand on the chest, a hand on the belly, and noticing where the breath is going. Noticing that if we're breathing through our nose or our mouth, noticing the depth of the breath, noticing the rate of the breath. Is it fast? Is it slow? Where is it coming from? And catching that is a really important initial first step. And then teaching people how to breathe correctly, because it's only as good as the advice that we then provide. And the advice we provide should be ideally nasal breathing when we need to be in a sympathetic or parasympathetic state, when we want the vagus nerve activated. Inhale through the nose, inhale into the diaphragm, into the belly. That belly breath is so, so important and completely overlooked. And it needs to ideally have a longer exhale and a shorter inhale. That's going to drive the respiratory sinus arrhythmia. That's going to drive, while we're inhaling, it's going to bring our heartbeat slightly closer together. And that is a sign that we are pushing towards a sympathetic state. And then as we exhale, as we lengthen out the time that we are on that release of oxygen or release of carbon dioxide through our lungs, and we're contracting the diaphragm and we're contracting those core muscles, what we're doing is we're lengthening that out and we're spreading out the beats of the heart. And what that does is it creates a lengthening of time between heartbeats, which is literally creating increased heart rate variability. And that is a main driver. So we need to look at the inhale versus the exhale. I like to do a 4-7-8 type of breath, or even a box breath is okay, but my preference is a longer exhale when I'm working with my patients. So 4 seconds of inhale, 7-second hold if they're able to do that, 8-second exhale, and a very slow, controlled exhale. Most people have a respiratory rate of between 15 and 16 breaths per minute. That's a little too fast for optimal function. We should be getting closer to that 10 to 12 breaths per minute, slowing everything down. But in a forced fashion, when we're doing that 4-7-8 breath, we're going down to 4 or 5 breaths per minute, which is ideal because it's really pushing towards that parasympathetic, vaguely activated state. So that's where I would definitely start, is look at the breath, look what's going on, and then we can start adding new therapeutic entities into the equation.
Well, that's a great news to use thing that people can really evaluate themselves. I wear an Oura ring and I measure, it measures your respiratory rate and it measures HRVs at some level of specificity. And I found personally that when I'm in a relaxed state, that my respiration rate goes down around 12 and a half. Normally it's around 14. And my HRV follows, obviously, track with the lowered respiration rate, it goes up. So I think that just from a phenomenological perspective, using these biometrics, we can use them as tools to kind of support where we are in this continuum of balance or imbalance between parasympathetic and sympathetic function. Dr. Stotts, over to you.
So first of all, I want to say I really enjoyed that conversation about breathing. And what you may not know is in a former life, I was very interested in martial arts and understanding the healing after injuries. We would go through almost exactly what Dr. Habib said in our breathing exercises. And we never talked about the vagus nerve. We never talked about the health benefits of what you've described, but what you are describing is 2,000, 4,000 years old. Not that I'm 2,000 or 4,000 years old, but I was studying ancient martial arts that were capturing that breathing exercise that you discussed, and it really was kind of fascinating. My DNA is as a interventional neuromodulation surgeon. I started implanting electrodes to help people with pain and migrated into other areas as well, and eventually came to the vagus nerve. But the area that we've worked on, we've known since 1997, there have been implants for epilepsy, showing that you could actually improve brain function, shall we say, with vagus nerve stimulation in epilepsy. Interestingly, we've figured out a way of doing this non-invasively. So stimulating the vagus nerve cervically non-invasively as a tool in our toolbox to, I'll say, biohack the system, to jump in and jumpstart it. And while I completely agree with doing the conservative approaches that you've described, there are some people who need a jumpstart, and there are some people who that's just not enough, and we really need to activate the vagus as well. So I think there's a lot of strategies, and your introduction to this, I think, was really, phenomenal, in that there are so many people who come to this and say, oh, my way is the best. It's cold water immersion. Well, what are they doing? They're activating the vagus. Deep breathing, what are they activating the vagus? Lamaze, what are you doing? Activating the vagus. Yoga, what are you doing? You're activating the vagus. I mean, and there's so many different strategies that have come to suggest that one is activating the vagus is helpful in set condition. I think we should just accept that vagus nerve stimulation is good. And now let's move on and say, what's the continuum of treatment that we offer our patients, from very simple and conservative that anybody can do at any time, to a little bit more complicated, and to even implants, which is going to be necessary for some people. And I think that continuum, we are still just at the beginning of understanding.
Well, boy, you're both delivering such important news to use. Let's finish off just by talking about some of the technologies that are available for stimulating vagal nerve tone, and what we know about them and their strengths and limitations. So, Dr. Stotts, maybe we'll stay with you on that first. Whoops, I think you're on mute.
Sorry,
There you go.
apologize. So practically speaking, we have 4 different approaches to stimulating the vagus nerve. Very conservative approaches, which would include safe and sound protocol, would include deep breathing, would include yoga, meditation. And those strategies, I think, are on the one end here. Second end, on the other end, would be implanted vagus nerve stimulators for epilepsy, and they're actually approved now for depression as well, for very severe depression. Not many people are going to get a $40,000 or $50,000 device for depression, which leaves us in the middle with 2 other strategies. One is the auricular stimulators. Auricular stimulators are approved now for addiction and for abdominal pain in children. So there's a couple of different strategies here. And then there's the cervical non-invasive approaches, which is what I've spent most of my time working on and studying. And that activates all 160,000 fibers in the neck, or it has the potential to activate all of those. Whereas the auricular branch has the potential to activate about 960 fibers. So it's less than 1% of the fibers going into the brain. The auricular fibers are all afferent fibers going into the trigeminal islands, and the cervical fibers have both a afferent and an efferent component. I would say frequency matters, and signal waveform matters. We've learned that. The device that we've worked on with electrocore and the gamma core device has got a 5,000 hertz sine wave, and that is actually really important because it alters the capacitance of the skin so it's not painful as the electrical field goes in. And then it's bursted at 25 hertz, which is really, turns out to be really important in terms of activating the vagus. So we've got all of these little factors that have occurred with the device that we've worked on. And then there's some Me Too devices out there that are using the square wave that I just don't frankly know if it works or not. But you can't assume because one waveform works that another waveform works. And so that's really my last take-home message, is that if you're going to make claims, we really need to make sure that you've done the science with those different devices to show that they have the same efficacy as the device that we've studied for so many years.
Well, thank you. That's really good insight for the person that's just kind of getting into this field. of therapeutics. Dr. Habib, I know you've had quite a bit of experience with the Gamma Core piece of equipment. What's been your experience, and how does it match into clinical outcomes?
Yeah, clinically, what I'm looking for when I'm working with the patient is what are they actually going to use readily and on a prescribed basis, and what's easy for them to implement into their daily life. And I very much love talking about the things at that one end where Dr. Stotts was speaking of adding in the breathing exercises, adding in the safe and sound protocol, adding in the yoga and the exercises and those tools. And they're very beneficial and they're very foundational, but they're very difficult for people to add in many of them all the time. Same on the other end, having an interventional surgical procedure that is invasive is obviously going to be prohibitive for a lot of people, and obviously not the best route for a lot in there as well. Where in the middle two, where I find efficacy is increased, is simply based on the fact that they don't need to do a 15 to 20 minute auricular stimulation, rather a 2 minute to 4 minute stimulation cervically on a spot that's relatively easy to find. And so it's a very simple handheld device that I have my patients either keep beside their sink and do it when they're brushing their teeth, and they just tie it as a habit stacking tool on top of what they're already going to be doing, or they have it on their bedside table and it's when they wake up or when they go to bed. And it's very simple, it's very easy. And honestly, the biggest change that I hear on a daily basis that people are experiencing is that improved sleep. They tend to be able to sleep through the night, which, as we know, when sleep is missing, when we're unable to get into a good deep sleep state and get that length of sleep that's required for recovery to occur, then we're not allowing that opportunity for the body to repair itself during that nighttime. So if we can improve sleep, if we can improve the body's innate ability to recover off of a simple 2 to 4 minute intervention, that for me is the simplest and easiest and most effective tool that patients can use. So what I always go back to is, will they use it, and where will it be easiest for them to implement on a daily basis? And the answer for me in my clinical practice has been use of a handheld cervical stimulator for 2 to 4 minutes multiple times a day.
Really exciting news. That certainly is in terms of timing, which seems like time is the most critical thing for behavior mod and compliance. That's very doable. So two last questions, one of which is it bilateral application? And secondly, approximately how long in your experience does it take for a patient to start feeling that they're having improvement in their vagal nerve function?
In my experience, there isn't a huge difference side to side. There has not been any major differences noticed in human studies, right side versus left side. There's no risk of anything happening with the carotid artery generally. It's a very, very safe procedure, very simple and easy for people to implement without any real risks to it. And in terms of noticing a benefit, I can say I've had patients notice a benefit after a single stimulation of 2 minutes. And for some people, it can take a month or so to start to notice changes. Obviously, there is an individual kind of requirement here or set of circumstances that need to occur. But if the ones that I find have a more immediate effect tend to be the ones that are not sleeping very well. And so if we can get that sleep working really well, that's where I find the benefits start to kick up and they're noticeable much more quickly.
Yeah, I'd answer slightly.
You get the last word, Dr. Stotts. So bring us on home.
Yeah, I'd answer slightly differently. We do know that in certain disorders, like headache disorders, stacking the two doses, 2 minutes, repeat it, a second 2 minutes on the same side is better than doing that on either side. However, on the other flip side of this, in the big study we did on acute COVID, patients hospitalized, deathly ill with COVID, and we measured C-reactive protein, interleukin-6, procalcitonin, D-dimer. We did the study 2 minutes on either side, a total of 4 minutes. So our protocols haven't been fully established. And I would say if you're looking for a preventive effect or a general therapeutic effect on decreasing inflammation, you need to give it a month or so. If in fact your goal is to treat an acute condition like a cluster headache or like a migraine headache, 2 minutes is frequently enough to abort the attack that someone's having right then and there. And it's remarkable how if you have this in your office and someone comes in with a headache, how frequently 2 minutes or 4 minutes will just abort the attack, and people can then say, oh, I'm convinced this is actually something that works for me. So I think about it in preventive, you got to give it some time. Acutely, you can see a benefit right away.
I think we've delivered the goods in this discussion. Dr. Stotz, Dr. Habib, I can't tell you how much I appreciate the opportunity to learn from both of you and to pass this information on to the literally thousands of people that will, I think, benefit from this program. So I thank you both, wish you well, and we will be following the vagal nerve story very closely. Thanks to your introduction.
Thanks so much. It was truly an honor to be with you. Thank you.
Thank you. And I want to thank all of those of you that participated in the program as part of our personalized lifestyle medicine program, and electroCore very much for their co-sponsorship of this program. We wish you well. Talk to you soon.